Hello, good evening. This is going to be video 726. It is almost 8 o'clock on January 26th, 2021, and wanted to give a brief update. I had my urologist appointment today with some kind of sombering news. I feel like a couple videos I was kind of not nonchalant, but I was very, I don't know, maybe it was me just being nervous. Um, Maybe a little agitated, but um, today I went and I talked to the urologist who also does GCS here in Louisville, and my my blood pressure shot up to 158 over 98. Usually it's about 120 over 80, and that's me on meds too. So my blood pressure really was up. I was very nervous, even though I don't think I showed it. But he's a very nice guy, very young, very young. Of course, anyone who's 40 or younger to me is young. Um, but he looked me over and we talked a little bit about what I was there for to address some bleeding that I've been feeling. And he kind of asked me some questions. And he said, "Well, how often are you dilating?" And I said, "Well, I kind of stopped." And he was like, "Why?" And I said, "Well, I just got tired of doing it." He was like, you know, in his own way, probably saying, "You dumbass," but he just kind of nodded his head, said, "Hmm." And he examined me, looked at me, and he at one point kind of gave me the one finger probe. Um, and he said he liked the results that I had gotten, and that things looked really good as far as the urethra goes. He noticed that he asked me, when I urinate, do I jet forward or do I go down? And I said, I jet forward. He said, yeah, that's apparently indicative of Dr. Gallagher's technique. Um, what he said is that the urethra tube, I guess, is kind of angled up. So the pee goes, pss, and he said he kind of does it so the tube kind of points down, so it goes psh, out of you. That's kind of cool. I think it's kind of neat. But anyway, Um, but he said everything looked really good, like I had healed really good. And he said, he said I felt some resistance in there. He said it might be the dilation. Um, but he said you might have an obstruction, which I had never heard of an obstruction. Sorry about the light there. I'm gonna draw you a quick picture. Highly scientific drawing apparatus. Okay. If if this is the vaginal tube that they make, and I talked in the other video, they take the scrotum and the erectile tissue and kind of fold it in on itself and stick it back in. They make this tube. Okay, this is where the cervix would be, and then this is the opening that kind of sticks out. That's kind of side view. Uh, this is your butt. Let me do this. All right, I'm laughing. That's a good sign. That's a really good sign. It's a really good sign. I'm laughing. Okay. So if this was your leg and your butt was over here, this would be the vaginal cavity, right? It's kind of angled like that, really. But anyway. So what he said is sometimes the way things heal the walls can kind of close in, kind of like that, and it creates kind of an obstruction. So he sticks his finger in there and goes, huh, and he said something about how the average, your depth of this tube, okay, is directly related to how much pee-pee you have. Okay. So, my pessimism my pessimism says, well, my pee-pee wasn't a big pee-pee, so I didn't get a big vagina. I don't know if it's true or not. Makes sense. If you have a big Schwanstucke, you're going to get a big tube, you know? If you have a small Schwanstucke, you might only get a little tube, and that's what I'm thinking my tube is. But anyway, he just said he couldn't tell if it was obstructed or not. And the only way to really find out for sure is to go in with a little camera, and it is called, I don't want to screw this up, a flexible cystoscopy. Cystoscopy. It is a procedure that is used to visually inspect the bladder and the urethra, but I don't think they're going to go up. They might go up the urethra. I don't think so. He wants to stick it up the vagina canal and to see if, in fact, there is an obstruction, or if he's really touching the back, what the cervix would be. Depending on if you know your female anatomy, the cervix is the sphincter muscle at the back of the vagina. And when that muscle opens, it creates a hole up into the uterus, which is where the baby is, or the, whatnot, where the baby's gestating and the baby comes through the canal and out. Okay, that's how babies are born, obviously, or the period comes through. And it's like a sphincter muscle. And we don't have that, us trans women. That's just the back of where they sewed all that skin together, our pee-pee. And again, it makes me think, back when I had my surgery initially, and that was when I was at my most flexible, my most, I guess it is flexibility. What is it when something's not rigid, flexible, elastic, elasticity. And I can remember after my surgery, the most width I could get was 2 fingers, my 2 fingers. That was as big as that hole was. And again, what I'm wondering is, if you have a really big penis that gives you more tissue, more tissue to make it bigger, and then maybe you could get 3 fingers in there, and my memory is not so good as far as having sex. I don't remember ever doing 3 fingers into a vagina. But anyway, my vagina is a 2 finger. Now it's a 1 finger. Okay, I need a shoehorn or something. The jaws of life. But no, I will start to dilate again. I use the purple, which is the smallest, and then build back up again to where I was. I was at the I want to say the green one is pretty big, but anyway, but no, what I was saying was, you measure the depth of penetration by the number of dots on it. It's got little dots. I think there's 5 or 7 dots, and the most I could ever get in was 3 dots. So I was maybe getting like this much depth in. And from what he was saying, I'm not going to flip you off, but from what he was saying, I mean, you should get, a good amount of depth, 4 or 5 inches of depth. And I only had 3 inches of depth. So what's going on there? What's going on there? Is there an obstruction? Was there an obstruction to begin with? Who knows? After my surgery, I went back once. It was optional. It was suggested at the time as an option to go get physical therapy. And it was up in Indianapolis. And it was with two physical therapists who would teach, how to wiggle your body, because my drawing here is a little bit wonky. Human anatomy is not linear. Okay, it's your body. I'm trying to draw this right. It's opening. There's a bone back there. Okay. There's a bone. I don't know if it's the pelvis bone or whatnot, but human anatomy, the male anatomy, when you stick this tube back there, you got to get over that hump, which is almost very suspiciously looking like that little obstruction, isn't it? But there's this little bump you got to get over, which is actually one of your bones that we men are blessed with, or we trans women are blessed with, and you actually have to go over that bone and around it, and who knows? And um, maybe it's not a genetic thing; it's a biological thing. We're all a bit different. No two of us are alike. Uh, twins with the exception, I suppose. But our configurations are, look, our configurations are different. Look at my fingers. Look at that. See how they bend? Your fingers may not do that. Mine do. Look at how straight these guys are. But look at these guys. They bend. Okay. So our bodies are so very, very different. And it might just be just enough of a change that it doesn't go in straight. I don't know. So in March, um, basically 4 years after my surgery, almost to the day, uh, they're going to scope me. They're going to take a little camera and go on a fantastic voyage up my canal and see exactly what's going on. And we'll kind of go from there. I need to take a quick drink, so hang on, just bear with just a moment. Thank you for your letting me do that. So anyway, so in a couple months he's going to scope me, and we'll kind of go from there and see what the next step is. And he kind of said to me, there are some things that he can do, like he can correct the urethra tube if I wanted to, and why is because when I pee, I have to angle my body and tilt back and get that tube in the toilet. If I sit down like a regular person, my tube is like this, and so I shoot urine through the toilet, the crack between the toilet seat and the toilet. The seat sits down, right? And it's got little nubs to keep it above the toilet, the porcelain. Well, my pee shoots through that hole, okay, if I'm not careful. So, but that's mild. That's not, too congenial. But what I want to know is if he can give me any more depth. And I think he was dancing around that. He didn't want to answer that question, and that may not be possible. Um, the more I think about it, if it's your erectile tissue, you've only got as much cloth as you have to begin with. You can't make more cloth. So, I may have just had a small penis, and so that's it. As good as it gets. Um, um, so that's that. And then the other thing we talked about was sensation. And I had made mention to you this before. I don't have any sensation down there. I don't have what you would, a clitoris. I do have a clitoris shape, but I don't get any, it's not pleasurable to rub or sensate or whatever. Now, a lot of that I think is because it's me doing it, and I just don't get the pleasure. as if maybe it was someone else, or be a little romantic here, maybe someone who I cared about and who loved me and wanted to make me feel good, then yeah, stimulate the clitoris. And I do know a couple trans women who swear by the little rabbit, the little rabbit vibrator they have, and I've got one that's kind of similar to what they have. I'll draw another picture here. Let's see. It's got a little nubby things on it. Yeah, something like that. Okay. Ta-da! It's got these little nubby things right there. And you stick that in your canal. I guess it's more like that. Yeah, I guess it's more like that. So this goes in your canal, and this plays with your little clitoris. Okay, and like I said, they swear by them. Probably they swear a lot by them. Doesn't work for me. I don't get it. I don't get the sensation. I just, you know, and I do have a couple dildos and everything. It just doesn't. It just a piece of plastic. I just don't get it. I'm not a, you know. Hmm. So, that's kind of the update, and we'll kind of see what goes from there. But I had asked him. I said, is there anything that we can do? And he was like, no. He said, basically, here we are, 3.5, 4, almost 4 years after I've had my surgery. Whatever neurons got cut and sewn back together again have healed. This is as good as it gets, and I can live with that. But I did have a good, hour pity party um, when I got back home, because I was like, there are some things that I think as trans folk, now I can only say trans women, firsthand experience, but there are some things that we just don't have access to. We just don't have access to, and I hate to say we don't as in never won't, but I think there are just some things maybe we just have to accept that we're never going to have. And for me, that would be, uh, an orgasm with a sexual partner. My odds of a sexual partner is astronomical. Um, I'm old. I'm not very attractive. I mean, stereotypically, whatever, but I'm old. Okay, I don't have that going for me. And I'm not really attracted to anybody. I mean, that's really my own hang up. I'm not really attracted to anybody sexually. And so, you know, it's my own doing. It's my own doing that I'm just not going to have that, what I imagined as being a very passionate, take me, I'm yours type moment, you know. And I didn't really get to experience it earlier in my life, because every time I had sex, I was imagining myself as the woman, So I wasn't in the moment, you know. It was I've never experienced that, you know, and it's just like, I'm not going to say it's a lie, but today he said something to me. He said, it's hard to say. He said, you probably will never have sex because your vagina is too small. And I said, that's when I said to him, I said, well, I was curious about it because initially I could only get 2 fingers in. I said, it's not like it shrunk. And he just said, well, you have what you have to work with. And that really just, it was like a blow to my ego, or a blow to my morale. It was like, so I'm gonna dilate and dilate and dilate. I'm gonna dilate. I am gonna dilate. But it's like, again, the lie. I don't know. I don't want to call it a lie, but it's like, you'll have GCS and you'll be a real woman, and the possibility you'll have sex. Da, da, da. You know, part of me is just sitting here going, that was a lie. You know, nobody told me. I told myself. And who knows? I mean, stranger things happen. I guess if I was of a certain moral, if my standards were lower, I mean, I probably could hire somebody like a male prostitute or something, but that's not my style. That's not me. And so maybe it'll happen one day. I don't know. You never want to say never, but I just got home and I was just like, it's it's somewhat of a lie we tell ourselves. I told myself. We'll take you out of it. I told myself. And maybe it'll come true. I don't know. And the other thing that really kind of hit me is, I stopped dilating because I got tired of it. But I also, went through a period of depression and I didn't want to live. I mean, you think I wanted to dilate? I wanted to kill myself. I didn't want to be alive. I was miserable, you know. And so part of me is like, wants to say, Robin, you did this to yourself. You stopped dilating. Small vagina and all. Whatever you had, you lost a little bit of because you stopped. Shame on you. And then the other part of me is like, well, wait a minute. I wanted to die. I wanted to kill myself. Um, you know, let's prioritize, you know, being alive, being dead, being alive, dead, so I can't beat myself too much up. But part of me, like I said, it's a pity party. It's like, it's just one of those things I'll never get to experience. And again, you never want to say never, but the odds are just not in my favor. Um, you know, if you know, 16 people out of 1,000 would consider dating me just because I'm trans, um, of those 16 people, what are the odds of a match? And again, you never know. And someone had said, you can't look at it that way. You just have to look at it as somewhat, some people get really, really lucky. And that could be it too. But um, it, my morale is shaken. I just have to say that my morale is very, very low right now, you know. And you know, I'm gonna push through it. I'm gonna, again, I know life is worth living, and it's a small inconvenience. Um, Earlier today, when I was at work, one of the guys came over and asked me a question, and it was, ma'am and miss, and you know, I don't have any reservation. I don't have any concerns about that. And I know that in a day-to-day basis, I'm going to get up, I'm going to go to work, I'm going to come home, and this is the life that I've chosen. And we're on the verge of spring. And my hope is that throughout the spring, I lose some weight. And maybe that'll help me feel better about myself. For all I know, the pleasure part of my clitoris is just, got fat around it. And I'm just sitting there rubbing body fat. And maybe if I lose enough fat, it'll come out. The clitoris. I don't know. I don't know. But it's I'm feeling lethargy right now, and it's the middle of winter. That's going to happen. So, a very rational part of me can make up these excuses, but there's still part of me that's like, oh man, that sucks. You know, you don't have a deep vagina because your penis wasn't big enough. You know, And yet, there's all these other blessings, and it definitely could be worse. You could not have had the operation, and then you'd be sitting here going, oh, if only I had the operation. And that's where I think the deception comes. That's why I want to say it's a lie. It's a bunch of bullshit. But there is some truth to it. There's some truth there. So anyway, that's my video for today. I'm gonna call it a night, and tomorrow is another day. And in truth be told, you already know what I'm about to tell you. We don't know what's gonna happen to us. In the same way that we could be hit by a car tomorrow and die instantly, um, something could come along and change everything. Um, whether it be a drug, a process, a solution, I don't know. Will I ever be a 22-year-old? Will I ever be a 12-year-old girl being a cheerleader? No. But I get to be a 50-year-old woman for the rest of my life. I get to be a woman for the rest of my life, and I'm happy with that. I'm happy with that. All right, so I'm gonna sign off. Good luck to you in your journey. Until next time, good luck. Bye bye.